Dear friends, my name is Dr. Igor Atabekov. I am a clinical oncologist practicing since 2010. Today I am continuing the topic of probiotics from the playlist of microbiome and the microbiome associated diseases and probiotics. We were talking about why microbiome is so necessary, can it help in, for example, cancer, and today we're talking about microbiome and probiotics and the diseases of gastrointestinal tract, starting from GERD or Helicobacter and going down to the guts. Let's get started. So microbiome is our organ of our body, and it's associated with our health and immunity. If we have some problem with microbiome dysbiosis, it may lead to many different conditions. For example, it may lead to depression, anxiety, dermatitis, allergic diseases like autoimmune diseases, joint problems, gut diseases, or even cancer. That's why it's very important to keep your guts and gut bacteria in the healthy and balanced state. And we can use probiotics for that. Intestinal microbiome consists of many trillions of bacteria and about 1,000 types of bacteria. And they may be altered by, for example, diet, lifestyle, bad habits, or intake of antibiotics. Probiotics help us with digestion. The bacteria have enzymes that we don't have. We can't digest, for example, fibers, but bacteria can, and they will eat these fibers. They will stop growing of bad bacteria. They will produce different vitamins and short-chain fatty acids that will, for example, kill cancer cells and go to our blood and control our brain function and pulse rate and feed our liver, support our liver, etc. For example, look at this table. We see these are different types of bacteria. For example, these are all lactobacilli. There are bifidobacteria, Streptococcus thermophilus. They help us with production of different substances like vitamins of B group, folate, B2 vitamin, or omega-3 fatty acids. Also, they can help in lactose intolerance to digest lactose. Most common types of probiotics are lactobacilli, bifidobacterium, some yeast probiotics like Saccharomyces, and different others like Enterococcus or, for example, Bacteroides, Streptococcus, etc. Probiotics can restore this balance of intestinal microbiota potentially and help in treatment of many conditions, including, of course, gastrointestinal diseases. Here there are some investigations on humans using probiotics. For example, they can be used in antibiotic-associated diarrhea, inflammatory bowel disease. Also, they were investigated in Crohn's disease or colorectal cancer and many others. For example, acute infectious diarrhea, when the person takes the food which is full of bad bacteria, they will produce toxins, make inflammation, and these patients get diarrhea. And Cochrane review of 63 randomized trials on children, infants, teenagers, adults, and elderly showed that probiotics can really help to decrease the length of this bacterial diarrhea for more than 24 hours. So it's quite good. But you should start it as soon as possible and continue intake of probiotics for at least 1 to 2 weeks. Next one, pseudomembranous colitis. It's a very serious condition. When the person takes antibiotics, they will kill most of the flora, but there are some bacteria that are not sensitive to these antibiotics. Classically, it's Clostridium difficile infection. And these bacteria will grow a lot because there is no competition. And it will produce toxins and membranes, pseudomembranes in the guts, inflammation, and a very massive diarrhea. And these patients can even die. And when the person takes antibiotics, the risk of this condition decreases significantly. Again, if you're taking antibiotics, better to start it right away and always take with antibiotic pill. And after you end the course of antibiotics, take probiotics for at least 1 to 2 weeks. Next, H.pylori, the bacteria that causes gastritis, that causes ulcers. in stomach, in duodenum, and it can also cause cancer. And compared to placebo, most probiotics were effective when supplemented together with the standard treatment of Helicobacter. By the way, there are two meta-analyses, and one showed that it's really effective, the other showed that it's not really effective. But anyway, when you take antibiotics, it's better to take probiotics. Next, cirrhosis. Cirrhosis is a severe condition when the liver is not working well. It can't disintoxicate the substances, it can't do its function, produce protein, and the person will have yellow skin, it will have a big belly, different other problems, and also the toxins will go to the brain and cause encephalopathy, meaning the person will be confused, not thinking very clearly, can be lost in time, for example, very aggressive or very sleepy. And probiotic intake can really help these patients to decrease the risks of this complication. Next, inflammatory bowel disease, ulcerative colitis, when there is a high inflammation in bowel and ulcers are formed. Probiotics can help to resolve the symptoms. It should be started as soon as possible when the exacerbation of ulcerative colitis starts, and then when it stops, maybe when it ends, maybe 1 to 2 weeks more of probiotic intake will be adequate. But probiotics shouldn't be taken to prevent the attack because it won't really help too much. Next is irritable bowel syndrome, when the person has visually normal gut, no problem on investigations, but it may have problems with gas, bloating, constipation, diarrhea, and pain in the belly. And they think that this is due to problem with the gut-brain axis, connection between microbiome and the brain. And in this case, we try to use probiotics for these patients. And probiotics can really help, especially if you take multi-strain supplements for at least 8 weeks. It may help with bloating, with flatulence, and with abdominal pain. And one more condition is constipation. In kids and adults with constipation, it may help to increase the frequency of stool. In little kids, in the newborn, it can help with colics. More than 200 infants were investigated, and they showed that probiotic use will decrease the number of crying episodes in that babies. Also, there is a very serious condition called necrotizing enterocolitis. This is the severe inflammation where the guts are very inflamed. They can even their piece of wall can be dead and perforated, and they can get the peritonitis. And usually they're preterm babies or babies who had very difficult labor with hypoxia, low oxygen level, and with maybe lung problems or heart problems are at risk. And probiotics can help these babies to reduce risk of this condition or to decrease the mortality. They should be started in all the infants that are at risk, or it should be started as soon as possible if it's already this condition is already diagnosed. Now, GERD, the reflux. The information, the results are not very clear, but in general, 13 prospective studies on patients with GERD, and they show that in general, probiotics may help with reflux, with dyspepsia, with heartburn, with nausea, with, for example, burping, belching, and gas-related symptoms. Small intestinal bacterial overgrowth is very common condition when there are too many bacteria growing in the small intestine, eating our nutrients and producing lots of gas. And there are several types depending on the type of gas which is produced and prevalent. And probiotics may help with the symptoms, first of all. It may help during the treatment of SIBO, when the person is trying to get rid of this extra bacteria. And also it helps with H2 type of SIBO. But they are not very effective in prevention of the next episode of SIBO after treatment, for example. About dosages. Cochrane review tells us that minimum 5 billion of colony-forming units should be taken a day. sometimes more. And the effectiveness depends on the species, on the condition, and on the doses. About the adverse reactions and risks, almost 25,000 of people taking probiotics did not have any really severe problems, any adverse reactions. The only problem may be cancer patients because they may have a low immunity. I was discussing this in the video about probiotics and cancer. Watch the playlist on probiotics, please, if you're interested. Clinical recommendations for today. Probiotics effective during antibiotic intake to reduce the risk of diarrhea. They can help with encephalopathy during cirrhosis to protect the brain. They help to get the remission in ulcerative colitis. They help in irritable bowel syndrome. They don't help in Crohn's disease or acute pancreatitis, and they help in preterm infants to decrease the risk of necrotizing enterocolitis. This is what we have for today, the recommendations. I can add some recommendations from myself, how to choose the proper probiotics. First of all, as we understand, there must be several types of different bacteria in the probiotic to increase effectiveness. Always watch that. Must be sufficient duration of intake. Usually when the condition goes away or when you stop taking antibiotics, 1 to 2 weeks is necessary. It must be more than 5 billion colony-forming units a day. Better when there are prebiotics added, and always look if there are any additional substances there that can be added. They can be, for example, vitamins of group B or kombucha or something else. And there is the nice table. I will put the link below for you to download it if you want the maximally scientific approach for this, because this shows the type of bacteria and the condition in which it proved its efficacy. It doesn't mean that these bacteria are not effective in other conditions or only this bacteria are effective, but this is what is already proven. For example, you want to treat the hepatic encephalopathy. You need to choose where there is a dot here. You want to treat ulcerative colitis. Please choose these bacteria. Dear viewers, thank you for your time. I hope it was interesting for you. I spent really a lot of time preparing this lecture and these slides and getting all this information, reading a lot of articles. Please, I would be grateful if you share this video to your friends or somebody who may be interested in that. And if you write any comment, like maybe you have any experience of using probiotics, if maybe you have any of these diseases and you're considering taking probiotics, maybe you were impressed by some information. Anyway, thank you for watching. My name is Dr. Igor Atabekov. See you in the next videos. God bless you. Wish you good health. Bye bye.